Good afternoon, everybody. Welcome. My name is Sandro Galea, and I have the privilege of serving as Dean of the Boston University School of Public Health. On behalf of our school, welcome. Today's event is the latest in our series of public health conversations. These conversations are chances to come together as a community to engage with the issues that are core to health. Health is downstream of the public debate. How we talk about the issues that matter most to health shapes how we approach the core social, economic, environmental, and political drivers of health in our society. Thank you for joining us for today's conversation, and in particular, thanks to many who made today happen, in particular, Meredith Brown and Alicia Noel for coordinating this event. Over the last 20 months, the world has faced a new normal. We had to find new ways of interacting, working, navigating public spaces, and more. We are now in a position to look beyond COVID to a post-pandemic future, to the next normal. What this normal looks like will depend on the choices we make now. If we can learn from the experience of the pandemic, we have a chance of making the next normal into a future that is far healthier than our past. This process starts with us having a conversation that informs a healthier status quo, one shaped by the lessons of the recent past. That is the goal of this event series. Today's conversation is about the link between politics and health. Over a century ago, the German physician Rudolf Virchow, someone whose work I admire, observed that politics is nothing but medicine at a larger scale. The link between politics and health was perhaps never clearer than during COVID-19. One of the more striking aspects of the pandemic was the extent to which nearly everything about it was politicized, from masks to vaccines. More broadly, we were faced with how politics shapes the socioeconomic context that generates health. We saw how political policies can support health, for example, through an economic stimulus that provides the materials necessary for healthy populations. And we saw how politics can undermine health by failing to support such policies, and by fueling a social context where misinformation and mistrust can spread. Creating a healthier future, then, means engaging with the political drivers of health. We are fortunate indeed to be joined by an expert panel to lead a discussion on how we can do so. Here to moderate this discussion is Kay Lazar. Kay is a health reporter for the Boston Globe. She was a finalist for the Pulitzer Prize in National Reporting in 2013 as part of a Globe team that covered the deadly fungal meningitis outbreak, and received a 2013 National Press Club Award for excellence in writing on issues facing the elderly. I have enjoyed both speaking to and reading Kay's work over the years. Kay, over to you.
Thank you, Dean Galea. It's a real honor to be here among these very distinguished panelists, and a real luxury to just listen and learn. Look forward to a really interesting conversation. So let me introduce the panelists. First, we will turn to Dr. Sandra L. Barnes. Dr. Barnes has been a joint appointed professor in the Department of Human and Organizational Development and the School of Divinity at Vanderbilt University since 2008. She has also served as the Assistant Vice Chancellor for Equity, Diversity, and Inclusion from 2016 to 2018. Her research and teaching areas include sociology of religion, inequality, urban sociology, statistics, and African American studies. Then we will hear from Professor David Bateman, an associate professor in the government department at Cornell University, where he is one of the co-directors of the Politics of Race, Immigration, Class, and Ethnicity Initiative, also known as the Price Initiative. His research focuses on the structures and ideologies of racism, as well as on democratic institutions, including voting rights, Congress, state constitutions, and US labor law. Third, we will hear from Professor Kelly Carter-Jackson, an associate professor in the Department of Africana Studies at Wellesley College. Her book, Forces and Freedom, Black Abolitionists and the Politics of Violence, provides the first historical analysis exclusively focused on the use of violence among antebellum Black activists. Carter-Jackson is also a commissioner for the Massachusetts Historical Commission, where she represents the Museum of African American History in Boston. And lastly, she is the co-host of the podcast, This Day in Esoteric Political History. And finally, we will turn to Dr. Kavita Patel, who is a non-resident fellow at the Brookings Institution. Previously, she was the managing director of clinical transformation at the Center for Health Policy at Brookings. She also served in the Obama administration as director of policy for the Office of Intergovernmental Affairs and Public Engagement at the White House. As a senior aide to Valerie Jarrett, President Obama's senior advisor, Dr. Patel played a critical role in policy development and evaluation of policy initiatives connected to health reform, financial regulatory reform, and economic recovery issues. And Dr. Barnes, we'll start with you.
I'd like to thank the team at the Boston University School of Public Health for this invitation to participate in the public conversation series. I'm going to be sharing some of the research outcomes linked to the COVID-19 pandemic from the disciplines of sociology, the sociology of religion, and African American studies. I actually began performing research on the implications of COVID-19 in the Black community in early 2020. And I focused on what's called hotspots, places like Indiana, Georgia, New York, and Illinois, where the pandemic was most prevalent. And so you'll notice I provided some blue highlighted percentages, and these patterns show that Black and brown people were and continue to be disproportionately represented in terms of not only the number of reported COVID cases, but the number of deaths. That particular ecological context informed my research, and also the following quote from the New England Journal of Medicine summarizes the intersecting historic and systemic dynamics that make Black, brown, and poor people in general more vulnerable to the pandemic. And I'd like to read just a few lines from this quote. Black communities bear the physical burdens of centuries of injustice, toxic exposures, racism, and white supremacist violence. Racism is productive. Any solution to racial health inequities must be rooted in the material conditions in which these inequities thrive. So it's important to address the social, economic, political, legal, educational, and healthcare systems that maintain structural racism. Because, as the COVID-19 pandemic so expeditiously illustrated, all policy is health policy. And I'd like to emphasize that last part of the quote, all policy is health policy. I contend that this quote is instructional because it correlates the importance and the need for systemic change to factors like politics, economics, and health broadly defined. It also reminds us that we can't effectively foster health equality in isolation. I'd like to talk a little bit about some of the patterns suggested in the research, especially if you want to think about challenges and opportunities. As most of you are well aware, we've seen an increase in terms of frontline trauma, where minorities and poor people in general are more apt to be frontline workers, to be exposed to increased risk, and to be exposed to the virus in general. My research suggests that respondents are concerned about this tension between meeting their economic needs as well as exposure to the pandemic. Also, persons spoke of practices as they attempted to be adaptive and resilient. A common theme was around concerns about vaccinations, as well as concerns about racial confrontations around the pandemic. We've also seen an increase in what's called civil religion that links religious features to US nationalism. And in this instance, dynamics like prayer and the Bible have been supplanted by patriotism, the American flag, and citizens' rights. And so basically, civil religion in its current iteration is undermining efforts to combat the pandemic, as well as undermining efforts to foster civil rights. Yet we've seen an increase in social activism in the form of involvement in, let's say, the Black Lives Matter movement, the Me Too movement, as well as community action to combat the pandemic by prophetic Black churches. And lastly, we've seen an increase in expectations, where swaths of people are beginning to think more holistically about not only the economic, but the non-economic implications of the pandemic in their lives and in the lives of their families. For example, statistics tell us that about 4.3 million people quit their jobs as of August of 2021. And we know that we have about 10 million unfilled service positions. So there's a mismatch between the expectations and the needs of potential employers and employees, where again, working class, poor, near poor people are refusing to return to the jobs that summarily dismissed them during the pandemic. And at least short term, they have governmental financial support to enable them to do just that. So when I think holistically, what we see is growing numbers of Black and brown people, working class people, poor people beginning to re-examine their lives and the quality of life and their life chances as a result of the pandemic. Based on these tragedies and trials that we can link to COVID-19, we're challenged to engage in more thoughtful, more holistic research. And this means being creative and being innovative as we center the experiences of historically marginalized and historically disenfranchised groups. It means participating in research that is intersectional, that is multidisciplinary, and that is mixed methodological. And using our findings, using our results in ways that are strategic, in ways that are thoughtful, in ways that represent best practices, such that we can respond to needs at the micro level, at the meso level, in terms of collectives and groups like Black churches, and ultimately at the macro level. Because in order to really turn the tide, systemic change is needed. Because many of the same structural challenges that continue to plague our nation, they're historical in nature, and they must be addressed in academic and applied ways. Ultimately, what we see in sociology and sociology of religion is that what was considered normal in the past is now unacceptable to a growing number of people, a growing number of diverse people, meaning our next normal cannot be our past normal. And in order to meet this challenge, we have to recognize that we're challenged to be agents of change in the world. And in order to do that, this means addressing the material conditions that foster health inequities. Thank you, and I'll be happy to answer any questions that you might have later in the session.
Thank you, Dr. Barnes. Next, we will turn to, and that was very interesting. I have some questions, so can't wait to do that. Next, we will turn to Professor David Bateman.
Thank you all so much. That was excellent. I learned a lot, Professor Barnes. I'm just going to quickly share my screen. All right, so hope you can see this. So I'm David Bateman. I'm Associate Professor in the Government Department and at the Brooks School of Public Policy at Cornell. So I was trying to grapple with this question of what challenges and opportunities did COVID-19 expose for the field of political science? And well, I just dropped opportunities. I think I was a bit too pessimistic and cynical, and I sort of got hung up on the challenges. And then, you know, that's the type of question that if you ask 3 political scientists, you'll get 37 different answers. And so I tried to sort of think about, well, what about sort of what challenges did it expose for me and sort of the things that I know about? So I want to sort of make clear right off the bat that my area is not in sort of the public policy of health. That's not my primary area of study at all. My primary area of study are democratic institutions and sort of the history of democratic institutions, voting rights, and democratization in the US and elsewhere. But one of the things I do study is Congress, and that is where I'm ultimately going to start. And I think that one of the three sort of things that I want to sort of highlight as to what COVID-19 exposed for me was that it helped underscore the centrality of what is often called crisis lawmaking, that it underscored the importance of the nationalization of politics that's been ongoing for a while, and how this nationalization complicates even basic administrative tasks at various points and limits much of the advantages that you would otherwise see in federalism. And then finally, and very much sort of in reflection of what Professor Barnes was talking about, I think the major challenge that COVID-19 exposed was the critical need to address the social determinants of health from a variety of different perspectives, from a variety of different sources. And here, this sort of goes to why I was perhaps more cynical. I would just say sort of see points 1 and 2, and I'll get to those. So I just want to start off with this notion of crisis lawmaking. So American institutions, American governing institutions are pretty fragmented, right? So as a result of this, there's a well-known, well-established conservative and status quo bias to these institutions, right? It's very tough to do things. It's very tough to actually change policy. And when you do change policy, you're almost certainly changing it less than you otherwise would. You're changing it less than there's probably a majority to do so. This has always been the case in the United States. Polarization has made it extremely difficult on important issues. It's not that Congress doesn't legislate or doesn't produce policy. It produces a ton. It legislates a ton. But on precisely those issues that are most pressing, it finds it very, very difficult to do so. Things such as the filibuster have only made this more difficult. One of the advantages of crises, and they've become increasingly important in recent decades, is that crises temporarily disrupt the perceived adequacy of existing policies for a variety of people who are sort of veto players within the system. So in April 2020 alone, 3 pieces of legislation were passed that were probably amongst the most consequential pieces of legislation in American history. They were huge, they were massive, they were unthinkable a couple of weeks before. Even going back to 2008, you would be hard pressed to find anything that equaled the level of this. All of this sort of seemed to belie, I think, notions that Congress can't legislate, or Congress is dysfunctional. Congress can legislate, Congress can function, but it increasingly relies on crises to do so, especially on sort of big ticket items. In fact, this has become so important to Congress that it regularly leverages the logic of crisis to try and get around gridlock. Right? So there's various actors in Congress, and have been for a while, but growing, especially in the last 10, 15 years, who try to use the debt ceiling or the threat of shutdown or the sequester, if you might remember it, as mechanisms to try to achieve policy changes that would otherwise not be enabled because of gridlock. So they threaten artificial crises in order to achieve policies that they didn't think they could do. And this is deeply problematic for a variety of senses. On the one hand, it does mean that you do get sometimes Congress responding very, very quickly, but not all crises are created equally. Just as Congress was responding to the pandemic very, very quickly with very substantial pieces of legislation, it was also doing next to nothing on police brutality. There were sort of ongoing demonstrations against police brutality. Congress introduced legislation, it advanced that legislation, but no one seriously thought it was going to pass or go anywhere. Congress did not experience that crisis in the same way. One of the other major problems of crisis lawmaking is that it doesn't lend itself to forward-looking policy making. It's very tough to engage in forward-looking policy making when you're constantly relying on crisis in order to do things. It also makes it very, very difficult to deal with long-term problems. And many of the social determinants of health, Professor Barnes talked about, and I'll sort of conclude with, are long-term structural problems that have no easy solution to them. All right, so the next thing that I wanted to talk about was just polarization and nationalization of politics. This was sort of the next big takeaway for me. As Dean Galea mentioned, almost every aspect of the public and institutional response to the pandemic was shaped by partisanship. I don't think this is very surprising. In fact, political scientists wouldn't have been surprised by this at all. However, one of the things that they may have found a bit surprising was that federalism and local control, which are oftentimes pointed as potential buffers for polarization, as ways of making it less problematic, that they were less important, they were limited in how effective they could be. And part of the reason for this was the nationalization of politics. As more and more attention is drawn towards national politics, as issue positions are taken in response to sort of national events, it becomes harder for even local actors who might share the same partisanship as you to influence your decisions. And local actors, governors, mayors, start looking towards national politics for cues. So the nationalization of politics limited the effectiveness that we might otherwise expect to see from local decentralized arrangements. You can see this in a variety of metrics. I'll just sort of briefly touch on 2. One is just individual behavior. There must be dozens of papers, all finding the basic thing of partisanship radically shapes not just perceptions of the importance of the COVID crisis, but behavior in it. So this is just measures of the importance of partisanship, Democrat or Republican, or just the changes in cases on the level, the degree to which people engaged in increased mobility. And basically, within a month, by April, Republicans are engaging in very sort of high levels of activity relative to independents or Democrats. Partisanship is driving this. At individual level, you'll find consistent evidence that partisanship is shaping how people engage and respond to public health measures. That's not a surprise. But you would think in a normal, it historically had been the case where if a Republican governor in Ohio made the case for staying at home, for instance, that Republicans in Ohio might be responsive. This is less and less true because increasingly we're taking our cues from national officials. It also matters for institutional responses. One of the sort of expectations of federalism is that by being responsible, governors would try and make sure that they damped down, sort of suppressed the death rate, that they took public health very, very seriously. And at the outset, many of them did. However, increasingly people were turning to the advantages of public office and trying to make name for themselves in a post-Trump, if we're ever in a post-Trump Republican Party, and they ran the record of did our best to stop any mandates. I want to highlight that this makes the United States an extreme outlier relative to the rest of the world. The rest of the world does not see this close correlation between the willingness to follow public health attitudes and partisanship. We just sort of take it for granted that this is going to happen in the United States. It is not true elsewhere. All right, and the third and sort of, I think, most important and most consequential thing to sort of keep in mind is about trust in the social determinants of health. There's an enormous amount of literature that shows that in terms of sort of engaging with public health responses, trust is hugely important. Do you get the vaccine or not? There's a generalized trust. Do you have trust in the government? You might have specific reasons not to. Do you have trust in the healthcare system? You might have specific reasons not to. You might also have a just generalized sense that these are not trustworthy agents. You need a high level of trust in order to be able to do these things. However, partisanship and trust in many ways are less individual decisions than they are social and political contexts themselves. In this sense, at least, they're very similar to more well-studied social determinants of health. We don't choose our partisanship for the most part. We take on our partisanship based on the context, experiences that we're living in, where we are, what our parents were. If we're now in turn sort of engaging in public health responses very differently because of our partisanship, we can think of that as a social determinant of health. Where you live matters enormously. Republican governments are not shutting down, and the likelihood that you're going to be exposed to the coronavirus or something else is going to be much higher. However, changing any of these social determinants of health, whether the standard ones of sort of inequalities in their various forms, or the deeper ones of partisanship and trust, these require large-scale policy interventions, such as universal health insurance, paid sick leave, upgraded wage insurance, tax reform, a whole gamut of ones. Now I'm drawing on this from the excellent work of Julia Lynch, who's really highlighted how investing in social welfare systems that promote social cohesion and trust in government are necessary not just for health equity and economic recovery, but for any future pandemics. But this brings us back to where I started. It is extremely difficult to imagine any version of these policies that is sort of appropriate or substantial enough to meet the requirements, making it through Congress. So I want to sort of leave us off with the possibility that Congress is the real crisis. Thank you.
Thank you, Professor Bateman. That was really interesting, and we'll certainly have a lot of questions as follow-up. Next, we'll turn to Professor Kelly Carter-Jackson.
Hi, everyone. First, I just want to say thank you so much for having me here today. I'm so excited, and this conversation is just going to generate a lot of really good discussion, and that makes me excited. I wasn't going to share my screen, and then when I saw everybody else, I was like, oh, I guess I will share my screen. I do have some slides I think that might be useful in just talking about what a new normal might look like and how we think of racism as a public health crisis. And so let me just share my screen really quickly. So I think that over the last year, we have really developed new ways of thinking about racism as a public health crisis. And I think this made itself so prominent in the pandemic, but also alongside the start of the pandemic, we had the murder of George Floyd, and you had massive protests all in the summer of 2020. And I think people were trying to make sense of multiple things at the same time. They were trying to make sense of this pandemic, trying to make sense of racism, trying to make sense of how we look at this at all different socioeconomic levels, trying to think of how we look at this within the mass incarceration and prison industrial complex. And it got complicated really quickly, trying to hold these multiple ideas all in one time, because it was not just one problem. And so, as a historian, I'm constantly looking at the past as a way to try to inform how we might think about the present, and equally important, how we might think about the future and what is possible in the future. And I study the abolitionists. And one of the reasons I study the abolitionists is because, they weren't trying to reform the institution of slavery. They were trying to abolish it. They wanted to create a new normal. And I think in having this conversation about how to create a new normal, we can't expect to reform some of these institutions. We can't expect to reform mass incarceration or the ways that we think about certain institutions that foster structural racism. We have to completely reimagine and in effect abolish some of the way that we do certain things. And so I wanted to use the abolitionists really as a blueprint or a roadmap for how I might think about the way forward, because everything that the abolitionists did, in my mind, is so useful in thinking about how movements are made. If you think about the abolitionists, they represented a large swath of a diverse population. You could be Black or white or born enslaved or born free or a man or a woman or poor or wealthy. Anyone who believed that the institution of slavery should be abolished could effectively be seen as an abolitionist. And the things that they did with the press and with slave narratives and the written word and politics and the vote, when we think of radical abolitionists and Reconstruction, like all of the tools in their toolkit are incredibly useful for thinking and reimagining and rethinking what a new world might look like. I like to use this quote a lot. It's by Joshua Easton, and it's from 1837. And the quote to me is just, it's borderline prophetic. Like he says, abolitionists may attack slaveholding, but there's a danger still that the spirit of slavery will survive in the form of prejudice after the system is overturned. Our warfare ought not to be against slavery alone, but against the spirit which makes color a mark of degradation. The spirit which makes color a mark of degradation. And in a lot of ways, what Joshua Easton says almost 200 years ago is so important, because we have abolished the institution of slavery, but the spirit of slavery is still very much with us today. And we see how the spirit of slavery gets manifested in every aspect of our lives, through housing and segregation, and certainly healthcare, through education and school segregation, mass incarceration, police brutality, wealth gaps, voting suppression, hiring practices, beauty politics, our friendships. The spirit of slavery pops its head up in every single aspect of our lives. And so, and rethinking like what this new normal has to look like, we really have to engage with the spirit of slavery. We can't just say, well, we abolished that, we ended that, and sort of go forward as though these attitudes still aren't stuck or still aren't at work in how we orient our lives. One of the ways I just saw how, the pandemic and also violent protest played a major role, and also how criminality played a major role. And I use these, two images here almost like as a joke, but the irony is so interesting to me. Khalil Gibran Muhammad, who is a sociologist, professor at Harvard, talks about this myth. And the myth being that like white people commit crimes, but Black people are criminals. White people commit crimes, but Black people are criminals. And this is so important, because if you look at, Michigan State when it won its game, or Michigan State when it loses a game, or if you look at January 6th, right, it's white people are committing crimes, but that's not who they are, right? This is boys will be boys, or people make mistakes, but that's not their identity. But when Black people commit crimes or not, doesn't matter, because Black people are criminals. So if your identity is tethered to criminality, then it makes it extremely difficult to navigate the world without being constantly thrown into a position where people are making judgments based on whether or not they deem you as worthy of care, as worthy of treatment, worthy of additional assistance, be it medical or otherwise. But this is the constant I say it's a myth, but in a lot of ways, it is the constant reality that many people of color face when their criminality is tethered to their health outcomes. Again, whether or not they have committed a crime, but that is how race and racism in the spirit of slavery, as Joshua Easton says, manifests itself over and over again, so that people have a very difficult time, not just accessing proper healthcare, but being treated fairly within the media, within the press, within their own communities. And that has huge implications for how we think about who's deserving of a certain education, who's deserving of a certain position or promotion. These things play out in a multitude of ways. And I want to say this because I think that, again, going back to the past, thinking about the causes of rebellion and all of the protests that we saw over the summer are just so instrumental in not just thinking about the optics, not just thinking about, looting or throwing a Molotov cocktail or people in bandanas or like these really images that become threatening, fires and burnings, but getting to the heart of the matter. Frederick Douglass, famous abolitionist, says in 1866, he says, "There's a cause to be thankful, even for rebellion. It is an impressive teacher, though a stern and terrible one." And then he cautioned us to remember that the thing worse than rebellion is the thing that causes rebellion. The thing worse than rebellion is the thing that causes rebellion. And I think oftentimes in these tumultuous times, we get so caught up on the rebellion, on the act, and we have not done the real hard work of saying, what is at the cause of January 6th? What is at the cause of George Floyd and Black Lives Matter protests? What is creating the real harm that is spurring these reactions to happen? There's a really good quote by Martin Luther King Jr. in which he's talking about riots. And he says, a riot is the language of the unheard. A riot is the language of the unheard. So that when people's needs are not being met, when they're not being heard, when they feel dismissed and marginalized by society, violence becomes one of those ways that people express their grievances, that people get attention drawn to their grievances. But when we focus again on like sort of the violent aspect of it, we miss so much that's at the core of what's really taking place. And because there's been so many moving parts within the pandemic and within social unrest and then with political unrest, I think we oftentimes lose sight of the causes of rebellion that Douglass is pointing us to, and really saying like, hey, as terrifying as this can be, there's a utility to this. There's a reason to be thankful for this because it's allowing us to see a path forward or a solution to people's grievances. And then I always use the civil rights movement as a way of talking about, protest. And I think it's interesting because when we talk about, the issues that the Black community and a lot of marginalized Indigenous communities and Latinx communities are facing, we like to look back on the past with a lot of nostalgia. And I think we look back on the civil rights movement with hand-holding and great speeches and nonviolent sit-ins. And, we can look at someone like in this picture of Rosa Parks, who's sort of sitting with her hands clasped in her lap. She's not even looking at the camera, she's looking out the window. And that is kind of the form of protest that we prefer. A very passive, non-aggressive, non-direct, sort of side-facing movement that doesn't really interrupt or clash with the status quo very much. And that's just not realistic, but it's also not a past that ever existed. That if you think about the civil rights movement, it's all about a response to violence at the voting booth, violence among children that are murdered, violence and lynchings, violence with fire hoses against teenagers, violence and harassment at lunch counters. Like there's so much violence, deadly, brutal violence that is taking place that I think we have looked back at this movement incorrectly as a way to find solutions that make us feel good or assuage some of the guilt that we might have about white supremacy, but don't really solve the problems. I also think that when we look back at things that feel very radical to us, like the Black Panthers and their use of guns and militancy, we say, oh, no, that was not the solution. But I think it's also interesting because the Black Panthers themselves were also people that realized very quickly, while guns are maybe useful, maybe there's a utility to the Second Amendment, this is not what's going to get our people free. What the Black Panthers were most successful at, and which they're least known for, was their free breakfast program that fed children, that said children can't study well in school until they're fed, until they have been given a proper meal. That when you think of the Black community and how sickle cell anemia has ravaged Black communities, we're going to test our communities. We're going to make sure that people have access to proper testing and HIV. We're going to set up our own ambulances. The Black Panthers parties had a free ambulance so that if you called 911, if you were in distress, it was the community taking care of the community. But their free food program, making sure that the communities that Black people lived in were nourished and they had access to great food. So I say all this because I think that when we think about revolutionary acts and creating a new normal, it does not have to be like guns and violence and terror. But I think what's really revolutionary and what the Black Panther Party understood was that people who are fed, people who are healthy, people who are literate, people who have access to proper education can change the environments around them. And that, in a lot of ways, is the reason why the Black Panther Party was so targeted by COINTELPRO and the FBI, not because of the guns, but because what should we do? What can we think is possible with someone who is fed and healthy and literate? Health has a huge impact on people's ability to recreate the world that they want to live in. So when I think about the movement for Black lives and I think about the pandemic, I think about how Black people are essentially pointing to how important it is to protect and preserve Black humanity. From the moment they're born to the moment that they die, from a very womb to tomb perspective, thinking about health as a revolutionary act, thinking about access to health as a revolutionary act is critical. And then lastly, I'll just close out by saying, you know, when we think about the past, we have a real dilemma. And that is because when I think about my parents and what they faced in the 1960s, this was their past. John Lewis being beaten by police for trying to register to vote. And when I think about my moment and my children's moment, you know, George Floyd is their present. So then how do we think about the future? If that's the past and this is the present, what does the future look like? Does it look like more violence? Will it require more violence? Or can we rethink systems to make them much more progressive and to work for all of us? And I'll lastly say this, and I think it's really helpful. This is a quote by Miriam Kaba. These solutions that we are all trying to create are not easy solutions. We have been at systemic racism for a long, long time. And I think it's worth saying that you can look at a circumstance or situation and maybe not have the answer, but you can also say, but this isn't it, not this. This isn't working. This is not working. And not this is an answer. It's a legitimate response. And I think that we can also be more focused on not just calling attention to crime, but really calling attention to harm. What is harmful? Not all crimes are harmful, and not all harms are crimes, but what matters most is what is harmful. What is harmful. And I think we're in a really important moment, and we can talk about what causes harm and how do we prevent it to make sure that everybody sort of has the health outcomes that they want to have from womb to tomb.
Thank you, Professor Carter Jackson. That was fascinating, particularly with the Black Panthers. I had not known some of that, so it was quite a learning experience. Thank you. And finally, we'll turn to Dr. Kavita Patel.
Great, thanks so much, Kay. Let me just go ahead and start sharing my screen. And I'm going to take my talk. First of all, thank you to everyone for inviting me. I have a little imposter syndrome because I look at all your backgrounds and the only thing I can think of is, well, I have a background in working in politics. And so that makes me somewhat adept at talking through the politics of health. And I pivoted. I was going to show, but I think that some of my co-panelists did a much better job presenting, at laying out some of the constructs, everything from systemic racism, kind of COVID, and how these worlds have collided, to kind of Congress and like I would say, I used to work in the Senate. So kind of what motivates or where kind of congressional action kind of comes to a fold. I'm going to pull up something. When I spent time in the Obama administration, we did a lot of work. I worked on the Affordable Care Act, and we did a lot of polling and tried to understand, especially as health reform was polling actually very poorly. And if some of you were students or doing research or just around during the kind of summer, the fateful summer of 2009, there were a series of protests, and nothing to the degree of kind of town hall protests we're seeing around vaccines, by the way, but there were a series of protests and town hall kind of conversations that turned pretty negative quickly in the summer of 2009 that I'll never forget, when I had to actually go to some of these town halls in different parts of the country where we were talking about health reform and what President Obama was trying to put forward in a health reform package, which was still being heavily debated on Congress and in the public. There were these series of signs in almost every single kind of town hall forum that would say, keep the government out of my Medicare. And I always thought that was quite ironic, given that that was one of President Lyndon Johnson's signature programs. So anyway, I'm happy to try to figure out how to kind of pivot a little bit back to COVID, but I thought that it would be fascinating to give perspective to what we learned the hard way in the Obama administration. It wasn't certainly news, but it was something that we had to think through around how does politics intersect with, at the time, health reform, and then I'll keep it current in the context of COVID. So these are some slides from Pew Charitable Trust, Pew Research Center rather, and sources on the bottom of each slide. But Pew Research Center, I think, is one of my favorite places to go for thinking through and understanding, not just in healthcare, but any sector, kind of the context, and give great clarity to, like, what I'll say is like the pulse of the country at times. And what's fascinating is that I did this on purpose, just to quickly kind of change and give you perspective. And we could use 2021 for much of this, but trust in the government at an all-time low. And then I think what's interesting here is kind of consistent liberal and conservatives living in different media worlds. It's something that I've seen dramatically in the course of, as a person who's taken care of COVID patients, and then also had to kind of take a step back and look at the national response to COVID. And you can see that there's kind of this consistency amongst people who self-identify as liberal about their media sources, and as a consistency amongst conservatives. And you could change and dial up or down some of these percentages, and maybe we would insert something like OAN and some other new media sources into some of these, but pretty much it stays to be a bit true. And it's interesting how much distrust versus trust. I just want to kind of point out that there's this sense of like liberals who trust more than they distrusted news sources that they surveyed. And then amongst self-identified conservatives who distrusted more than they trusted news sources. And for me, that sets up this dichotomy of how we have approached healthcare and how we've approached many other things. And by ideological group, also, again, self-identified kind of liberal, or people on a spectrum of identifying from kind of consistently liberal to consistently conservative. And you can take every single one of these, like, sources of news and just look at how the yellow and red stack up, and everything from one of my favorites, The Daily Show, all the way to New York Times. And I think this tells us, I grew up in the South in Texas, and still to this day kind of comparing and contrasting notes with friends of mine from grade school or high school, people who I've grown up with and completely have not just different political views, but even on something, for example, kind of the ability to trust the science of a COVID-19 vaccine, how heavily these news sources have informed what have become almost taken as fact. And so I'm going to talk about that in a second here. And then social media, we haven't touched on it, which is why I thought this would be helpful. So much of my kind of version of politics and health really does have this kind of filter if you dial back and look at the origins in social media. And it's been, I mean, nobody, if you haven't kind of picked up a virtual newspaper, a real newspaper, and seen some of the most recent controversy around Facebook, you can understand, and I think any of us who have had to deal with misinformation around COVID, we've been dealing with misinformation around healthcare for such a long time. So I think this is, I'll just kind of go through, this is something to me that for me is, it's an underpinning of why politics and health and the intersection of racism, equity, and truth and lies kind of all come into this like very kind of clunky Venn diagram. And it has a lot to do with kind of how we treat each other online. And I was struck, this was one of the statistics that troubled me on so many levels. And this is several years old, so I can only imagine it's gotten worse. That a little under half of people kind of engaged in social media have experienced online harassment. Everything from, sustained harassment, stalking, and sexual harassment, to now with public health officials who have had death threats, and a health system that I work for. Two of our largest expenses in COVID, one has been staffing. So staffing because we've had an overwhelming demand of healthcare services and we just do not have enough people to take care of people. The second, which might trouble you, that we've seen a surge in, is staffing for security. And it's everything for security for our employees in parking lots, because it's not death threats to individuals, but just a heightened degree of violence, in particular in healthcare settings. So it creates kind of this toxic environment, which kind of thinking through some of those contrasts and pictures in kind of the march for civil rights and some of the movements, that absolutely there's been blood spilled and absolutely there's been violence shed. And in this scenario, some of that violence has been propagated by these very online forums. Okay, so then let's talk about facts and what people see as kind of a problem with why Americans are confused about basic facts. And, we've all kind of probably used this phrase, I have personally, fake news. But it's definitely something that Americans, and this is 2016, 5 years ago, I would again argue that number, 64% of adults who say completely made up news has caused fake, problems about the basic fact, a great deal of confusion about the basic facts of current events. That number has absolutely gone up. And then fake news is seen as a problem in and of itself because of adults who, and in this survey, who kind of reported sharing or actually kind of knowing at the time that something was made up and then sharing that. And it's just an incredible, for me, as we were all, my co-panelists were speaking, I have struggled still so much to this day with people who in my practice are offering me and showing me kind of Facebook posts about the real kind of tragedy of vaccines and how much is not being reported by the CDC and kind of the lies. And then when I point out to them and I say, well, let me see your sources, and we talk through it, which often takes, 15 to 20 minutes that I actually don't have, but I feel like this is important. When we start to go through that, they'll acknowledge like, yeah, this source, who a friend of a friend of a friend, yeah, they don't know what they're talking about. In the same breath as they're telling me, no, Dr. Patel, this is absolutely the reason why, I'm not going to get a vaccine. And then posting this information. So what is it about people? I find myself as a clinical medicine kind of expert, finding myself becoming a lot more about the behaviors of people. So why is it that people feel like they want to or have had false information posted about them? And if you look, the reason I drew an arrow to that demographic is look at the band of ages that we're hitting the most and where they're having false information posted about them, and how much, if you add, this is again several years old, if you just keep adding to this, the devastation that this creates. And unfortunately, it's also something in our society, getting to kind of the topic at hand of politics and health. There's nothing that gets more attention than some of these like incredibly like disagreeable, just to be disagreeable posts. And this then becomes currency in our current language. And it may not be currency that some of the attendees or even myself kind of value, but we have to be very honest about this is the currency of why there is such a visceral reaction about certain health topics. And I know we were kind of trying to use the umbrella and talking about the pandemic. I think that what's happening in voting rights with abortion, what's on the docket for the courts is absolutely health and absolutely healthcare and is absolutely political. And if you don't believe it, or if you want to challenge me on it, we can take that up during the Q&A. But there's no question in my mind that some of the most important kind of fundamental, I'll call them rights, because I think they are, the right to be able to vote in different manners and not feel like you have to be prevented from voting because you need a drink of water, or being able to give someone a drink of water and being able to vote. Very basic conditions, as well as the condition of women's reproductive rights. All of that is getting kind of taken into and layered upon these contexts around how we receive information, how we give people information, how we want people to agree with us, or how much we want to literally violently disagree with others. And here's my, because this is Boston University and a great host of learning, it's why I thoroughly miss and love being around people who are learning. And they tend to be younger, but I'm going to use the word younger, not just in age, but younger and kind of where like you are in terms of your brain and your ability to form opinions. It is true that it's one of the reasons I love being parts of academic and undergraduate and graduate institutions, because there feels like there's this kind of window where people can distinguish between facts and opinions and engage in dialogue. And sadly, it gets harder, or it seems to get harder as people are removed from that environment or as they're older. So then, I'm not going to overdo the slides, but I do want to just kind of highlight and point out that, you know, we talk a lot about the kind of quote bell curve or the middle of America, that people are really not kind of at these opposites. But I think this was really, at least for me, very educational, that may have been true a couple of decades ago, but that there are now kind of, you know, if you look at the boulder on the right, it's less of less of kind of the hill and a little bit more of like a staggered, kind of a staggered cliff, so to speak, on some levels. And I think that there's more viewpoints that do actually reflect that. And then this is a little hard to read, so let me just go back to, so now we see that kind of the party and people's identity by party kind of far exceeds other divisions. It used to be when I was growing up that my parents would say, you know, you don't talk about like religion and politics at dinner parties. And now it feels like this is the conversation. And that if you look around even your own personal social network of friends, you tend to have this kind of social network that really does like align generally on party lines. I find it interesting. Since I live and work in a town like Washington, D.C., some of my closest friends are actually people who worked in the Trump administration or the George W. Bush administration. That's a bit of an outlier, I would say. In more cases than not, it's usually the opposite, where people do try to converge around kind of like principles, and they tend to be, as this slide illustrates, by party. And then the other kind of the contrary to that is, or at least the complement rather to that, is that people don't really have any confidence in the political wisdom of American people. So you can imagine that as we talk about very important health issues, COVID-19, abortion, child health care access, some of the conversations being debated around the current infrastructure bill. Since I'm a creature of the Senate, I'm very much in tune to now latest negotiations talking about dropping Medicare benefits that I would have said to you, slam dunk, no brainer, to put in dental and hearing benefits. Like, who does not think that that's going to win political points during a midterm election year 2022? That might be off the table. And you kind of see like how all of these worlds converge. So I'll go ahead and just for the sake of time, since I think I'm sure Kay has some really juicy questions for us, but I'm going to just go ahead and just highlight again, coming back to this notion of social media and kind of the influence of like tech on us. It's very interesting as we're also having this conversation about climate change and kind of policy. Technology companies, and you can see that pharmaceutical companies are kind of viewed as having too much power and influence, something that is playing out in the current debate around infrastructure, because a number of what I would say are cost-saving pharmaceutical drug provisions are supposedly being left out. But look at what I would say is the technology industry, the energy industry, banks, finance, farmers, agriculture, small business. I highlight tech companies because, again, these are several years old, but can only be felt to be too much. And that's the power and influence. So when you take into context your top, this is 8 kind of entities that have outsized, outweighed, disproportionate influence, it's no wonder that people then, from recipients of too much influence and too much power, that any information that's disseminated, and it's really convenient for me to say it's quote media, it's not, becomes the way our conversations happen in the water cooler. It becomes, why aren't we talking about drug prices more when that is such a prescient kind of problem in our country today? And then social media sites, kind of the same in terms of protecting personal data, but I'm also still mystified as a physician who kind of has to be trained in patient privacy and how much is regulated around that for me with personal health identifiers and things that obviously I can't talk about with people, how much people put personal health information on social media for anyone in the world to see. So it's interesting to me that people say they quote few trust social media sites, and then also see how many people at the same time are willing to put in personal information. So I'll actually, just for I'm going to kind of go to the bottom line here, that there's at the end of the day, you might say, and especially in light of Facebook, there may be a movement to think about how does information or misinformation play a role and who and what should do something about it. But it is interesting that there's still kind of disagreement on whether or not it should be the government, for example, that kind of steps in around misinformation. And then I'll just close by saying that for my point of view as a licensed physician, I was very pleased when I saw the Federation of State Medical Boards, and I'm an internist, and I'm board certified by the American Board of Internal Medicine, that those entities said and made a very clear statement months ago that misinformation propagated by health professionals absolutely needs to be limited, and that it could result in the revoking of your medical license or even the rescindment of your medical certification, which is a very big deal in medicine. And I think that, to me, I haven't seen anyone actually have not seen anyone suffer from that consequence. And I think that at some point we can talk about kind of who should restrict and what the politics of the health can lead with kind of misinformation contributing to it. But if there's little accountability for that misinformation, which desperately kind of is part of the problem when politics, health, lies, and kind of the inability to distinguish between facts and lies so that people can understand how to really think through some of these really important issues, then what is a kind of the world that we enter if there is no accountability? So I'll stop there and stop sharing my screen. And thank you to everyone for letting me rant about some of the things I've seen in my time in Washington and be able to talk about with such an esteemed group.
Thank you, Dr. Patel. That was a lot to sink your teeth into. I see we have a bunch of questions here, and I want to give everyone a chance to get their questions answered. So I think I'll start with them and then sprinkle in some of mine too. But this first question is for Dr. Bateman. I'll read it. Do you believe that this kind of polarization and political nationalism would have occurred in the same magnitude 10 years ago, or frankly, even 5 years ago? Dr. Bateman.
To this exact same magnitude, probably not, but more or less, yeah. I think that, and I would go to Kavita's point about remembering 2009, the sort of protests that were ongoing there, the lies that were spread about with the Affordable Care Act. Polarization has been ongoing for a while, basically at least the last sort of 30 years. It gets more and more intense. The pandemic definitely sort of pushed it to the brink. Trump pushed it further in a variety of ways, sorted the parties even further in ways that sort of encourage more and more polarization. But the nationalization of politics as well has also been ongoing, right? Most of us do not pay attention to state politics. Very few of us pay attention to local politics. And while that's long been kind of true that we pay more attention to national politics, the degree to which that's true has radically changed. And if you think, I expect that there's a variety, we know that there are a variety of causes for this. One even just includes sort of the rise of cable news and the decline of local news. Others would be sort of the increased role of social media. I learn about things from my hometown from social media, but I couldn't care less in a way. But like the vast majority of political news I see in social media is national news. And that's not surprising. Local news stations have gone down. As all of these sort of things decline, it becomes harder for the types of sort of things that might sort of put a brake on polarization to do so, right? The parties have always been internally divided, and usually in ways that are deeply terrible. Those divisions aren't there anymore. They're still sort of somewhat there, but those divisions look different, right? And we're increasingly operating, as Kavita highlighted, different sort of epistemic universes in which, but like, it's not exclusively sort of Democrats, Republicans. That's layered on top of other separations, sort of between sort of working class constituencies in both parties and professional classes and middle classes in both parties. They're operating in different worlds, but they're getting media streams from sort of distinct ones that separate them out. So all of this to say that I think that, yeah, that it wouldn't have been maybe as severe 10 years ago, 5 years ago, but I think would have definitely been pretty severe.
Thank you. I have to think about there. Boy, the questions are just flowing in here. This one was not directed at one person, but I think Dr. Patel would be a good person for this one. And the question is, how can we bring COVID deniers into the fold? The person says and points out correctly that at this point, people are well aware of COVID. It's not a new thing, but that we seem to be getting stuck in the forgetting mode of how serious this virus is, with cold and flu season coming on. And so the question is, how can we address that?
Yeah, I wish I had like an easy answer for this, Kay. I think that number one, we're seeing what I would say is a behavioral phenomenon where kind of with time, we all tend to be a little bit more normalized. I mean, I'll be honest, we still have, 74,000 cases today, about 1,100 deaths, maybe 1,200 deaths in 24 hours. I mean, in any other time in history, that would it'll alone make news. So even the non-COVID deniers, people who really understand, myself included, who understand how horrible this virus can be, also kind of feel like, and I think it's the brain's way of coping, that we just tend to it's not blocking it or denying it, but we have a way where it becomes part of our daily life. So part of my strategy with true kind of COVID deniers, this is a conspiracy, Tony Fauci manufactured this in a lab, et cetera, is actually kind of the same tactic I take with vaccine deniers or people who are incredibly resistant to vaccines. I actually start with a place and a posture. Most of them haven't Googled what my political background is or who I worked for, or they might not want to listen. But I usually start with a posture of I get it. It all feels like a science fiction novel, doesn't it? And so then we kind of go through. And usually what works better is to then use something that's really important to that individual. I am not going to convince them and change their mind. What I can do is say, let's accept that, there are some things that don't make sense and I'm not really sure. Who are some people that are really important to you, or who are some people you haven't been able to see, or how can we kind of pull at something that then gets them out of that kind of WhatsApp, here's what my Facebook page told me, and something incredibly individual. And it is a very hard job, and it takes a lot to do that. You can't do it as a society very easily, but it has been the most effective kind of intervention I've engaged in. But I also feel just to get back to my kind of very briefly, Kate, just my philosophy of why I love being around people who want to learn, that we need to do a better job probably teaching people how to discern and distinguish fact from fiction. And for some reason that actually has been lost a little bit in the dialogue, but it can be at least a foundation so that we don't have I feel like right now we have fertilizer and a ripe sort of kind of soil for deniers and misinformation. I don't feel like that garden in the soil is as ripe for people, I want to say probably like us, who don't mind being disagreed with, but would like to say that we understand how to separate fact from fiction. And so I know someone wants to have an optimistic tone because this all sounds so doom and gloom. I do think coming out of this, the fact that we're having this, the fact that the university is sponsoring this series, the public health school, Dr. Galea, people who I respect, I feel like we can't let this go. And there has been this renaissance. I've never seen so many people who understand epidemiology. I've never seen so many people who understand like what an R-naught is outside of, I have a public health degree. So, it's fascinating. So we need to capture that, and we need to take and harness that somewhere, somehow, people have now kind of normalized, like hearing from Tony Fauci every day and hearing from respected scientists and people like all my co-panelists who do important research. I would say the challenge is, and you're an expert at communicating. We need to communicate that better. That's really what this tells me, but it's possible and it's within our reach.
Thank you, and that's a good point about the media too, and being able to communicate it better. I'm struck by this next question because 2 or 3 of the audience members asked the same question in the same way, and I'd like to address this one to Dr. Barnes. They said that the presenters have all been superb, and the prospects for the future about public health and politics, et cetera, about people being pessimistic. It's, some of this is a little depressing, and the questioners want to know if there are any optimistic take-home messages. In other words, is there something that we can look forward to that a little bit more promising? Dr. Barnes.
Well, I would say yes and no. I think that it's important to be realistic about some of the challenges that we face so that we don't romanticize some really dire situations for people who are really facing quite a few kind of intersecting challenges. One of the things that I always challenge persons to think about is when we're talking about these intersecting problems, if we just have a Band-Aid effect, then a Band-Aid, let's say, solution, then what we're doing is we're saying we're going to help poor people do a better job at being poor. We're going to help minorities do a better job at navigating discrimination and racism in its many forms. So I like to couch my response by saying we want to make sure we don't romanticize this situation around COVID-19 in particular and health disparities in general. Having said that, one of the things that has emerged in my research around, especially COVID-19 and the Black experience and the experience with poor people, is how adaptive and resilient people are in spite of the plethora of challenges they're experiencing in terms of again, because we're talking about health and we're also talking about people who are experiencing, they're running right into the, the civil religion folks. They're running right into the Trumpers. They're running right in, they're in their frontline jobs are exposing them to not only the pandemic, but to racism and to classism and to sexism. And the fact that people are navigating these quagmires really is a testament to them. And I say that while again, making sure that we don't say, well, they're adaptive and resilient, we don't have to do anything. That's not the point, because people are still experiencing trauma. And I'm contending that we don't even have an idea of how long this trauma will last and the way in which it's going to be manifesting 5 or 10 years from now. So the good news is that persons who have had a history of navigating challenges are somehow continuing to do that. The bad news is that we don't really know how long this trauma and this form of trauma is going to affect persons. And then another piece of good news that I would like to suggest is, and going back to my comment about changing expectations. I think one of the major takeaways is that people are saying enough is enough, whether it be in a political arena, traditional political arena, whether it be in terms of the job. I'm not going back to that job. And that, to me, that elevates even the level of expectation. It elevates what people are expecting from each other, what we're expecting from the political machine, what we're expecting from just people who are our neighbors. All of those expectations are being elevated, and that can only cause, those things can only be good.
That's optimistic. Thank you. I appreciate that. I'm sorry?
Oh, I just wanted to echo what
Sure.
Dr. Barnes just said, because I think it's so important that as much as a lot of us have been maybe upset by cancel culture. I do think that there is an empowerment about being able to say, nope, not this, nope, not you, nope, you gotta go. like that sort of desire to immediately stop all the behavior, the toxicity, to call it out, to cancel it, to say, nope, we don't have a solution, but this ain't it. Like, or to look at the labor shortage and to say, like, not that wage, that's not what I'm doing, not for this job. I think people are really saying no, and that no gives me a lot of encouragement. No to injustice, no to poor wages, no to not a living wage, no to not having a quality of life that you want to have. Like, that no is so important. And I think we've been a culture that's just been conditioned to sort of like eat things and accept things and move on and just, keep the status quo going. But I'm encouraged, especially by the younger generations, that are refusing to do that.
Thank you. Thank you. That is hopeful. And we're quickly running out of time. I think we have time for one more quick question. I'm going to throw this to Dr. Bateman, because he was talking about politics, et cetera. There is the polarization. Oh, I think Dr. Galea is coming. We have 1 minute left. Extremely polarizing issues concerning, and one of the questioners asked if there's what can be done about the responsibility to fix the seeds of disinformation, particularly in agencies. And we have 1 minute left, so a quick response, Dr. Bateman.
So to the responsibility of agencies for producing this polarization, I think that, one of the basic difficulties of polarization and distrust in the United States is that the United States has a deep history of being distrustworthy, I should say, right? That there's a good reasons for polarization. And I don't think we do want to go back to an era in which polarization was low. An era in which polarization was low between the parties was an era in which critical issues were being kept off the table. Sort of civil rights being the most important, right? That these were we kept sort of polarization low by dampening fundamental questions that needed to be resolved. Instead, I think we need to confront it and resolve those questions. This goes to the point that Professor Barnes has made, that Professor Carter Jackson has made, that these things are not easy, but they are important and they have to be dealt with face first.
Thank you. I am so sorry that we have like at least a dozen more questions in the queue, all of them terrific. You all have just been fascinating. I wish we had another hour. We don't. So thank you all so much. And I will return it over to Dean Galea. Thank you.
Well, I will first of all echo Kay to say thank you to all our panelists, and thank you to Kay herself. Thank you to all the audience participants. I thought there have been some outstanding questions. I learned from all of you. I thought this was just a fascinating conversation. If I may just take one thread which fills me with hope, because I actually do think it's important to have these conversations and to leave them with hope. It's Professor Patel mentioned that we're at a moment of a renaissance in thinking about a lot of these ideas, which I really like. I must admit I had not thought of that word in the context of a lot of these ideas coming to the surface. And I think it's important. I think it's important that we remember that there is a tremendous moment of opportunity. I've often in my writing and my speaking lately, I've been saying that nothing can redeem the tragedy that is COVID-19. COVID-19 is a really tragic moment in the country's history, but it would be even more of a tragedy if we don't learn from it. It would be more of a tragedy if we actually do not allow these ideas to come forward and we do not work towards creating a better next normal. And I think it's conversations like this that are going to create that next normal. So I just want to say thank everybody in this panel, and thank the audience for engaging with that. And to everybody, thank you for everything you do